everyone, welcome back to Essence of Damiana. I'm Ree and this is Sarah, and we're reporting live from San Diego, California. And we usually like to honor the land that we're on, and this is the land of the Kumeyaay. This YouTube video, we're going to be focusing on naturopathic medicine and all the questions that everyone has about it, so stay tuned.
The first question is, what is naturopathic medicine? And we really like the definition that the AANMC has, and that is the American Association of Naturopathic Medical Colleges. And their definition for naturopathic medicine is a distinct healthcare profession that combines the wisdom of nature with the rigors of modern science. And naturopathic doctors are trained as primary care providers who diagnose, treat, and manage patients with acute and chronic conditions while addressing disease and dysfunction at the level of the mind, body, and spirit.
Yep, we love that definition.
So it covers the bases pretty well. Understanding the 6 naturopathic principles is one way to really better understand naturopathic medicine. So we will go over those now. The first principle is primum non nocere, which means first do no harm. And that is the Hippocratic oath that all doctors take. And that sounds pretty self-explanatory, but basically it's just a reminder that we don't want to cause any more harm to our patients. So when treating them, always following an order that uses the least invasive therapies first, and only using higher interventions that might have side effects only when completely necessary.
And then the second principle is Vis Medicatrix Naturae, and that's the healing power of nature. And just kind of like how when you get a paper cut, you forget about it, and then all of a sudden you look and it's healed. We believe that our bodies have this innate power to heal itself. And so in naturopathic medicine, we like to focus on nourishing the body so then the body can do what it's innately known to do.
Exactly. The next principle is prevenire, which means prevention, which is a really big one for naturopathic medicine. And that basically means that we focus on building a strong foundation of health in order to prevent disease.
And then the next one is Tole Totem. So I know we always emphasize mind, body, and spirit, and that's because we believe that it's working synergistically within each other. And so when we're treating our patient, we don't want to just focus on one symptom or like one body system. We want to remember that the person is a whole entity.
Exactly. The next principle is Tole Causam, which means treat the cause. So in naturopathic medicine, we focus on finding and treating the cause. Oftentimes our body is giving us symptoms because something is wrong. So instead of just suppressing those symptoms with different treatments, we actually use those symptoms as clues to find out the cause of their symptoms and then treating from there.
So the last principle is Docere, which means doctor is teacher, and that just reminds us that we have the medical training through our school, but we always have to remember that the patient knows their bodies the most, and they know what instinctively or intuitively feels right, and we just want to give them all the information about their condition or about treatment options so they can make an empowered decision for their healing journey.
So the next topic we'd like to discuss is the therapeutic order, and as I spoke about when I was discussing first do no harm, naturopathic doctors like to follow a therapeutic order of using the least invasive therapies first. So the therapeutic order is basically a pyramid, and starting at the bottom, we focus on establishing a foundation for optimal health, which involves identifying and removing any obstacles to cure, and assessing the determinants of health, which basically is just diet, exercise, stress, sleep hygiene, and different modifiable lifestyle factors.
And then the next level up from that is stimulating the self-healing mechanism. So what we kind of mentioned with Vis Medicatrix Naturae, just stimulating our body so it feels nourished enough to do all the healing work for us.
Exactly. And then the next highest intervention would be supporting and restoring weakened systems. There's many ways that we can do that.
And then the next level up from that would be addressing physical ailments or alignments. And if we're feeling disaligned, then we can use some of our modalities, which we'll be touching on later, to help you in that way.
Exactly. And then the next highest up is natural symptom control. So that's using natural substances such as supplements and herbs and other things to alleviate symptoms. And that is opposed from synthetic symptom relief, which is the next highest up, which is using pharmaceuticals to address those symptoms.
And then the highest corner of the pyramid is high force intervention. So that could be if someone comes in with a cut and we need to do minor surgery, or we have to refer them out to the ER or anything like that where we feel like it's out of our scope so they can get the best care that they need. And this therapeutic order is really important for us, and we determine which level we intervene at depending on the patient's presentation that are sitting in front of us. So we want to do the least harm. So if they need a higher intervention, we're comfortable to do that for them. But optimally, we would want to start at the bottom.
Exactly. So a lot of you might be wondering what a visit with an ND looks like, and going to a naturopathic medical office is slightly different than going to another doctor's office. The initial intake could take anywhere between an hour and an hour and a half, and during that intake the actual doctor spends a lot of time with you, and that involves a really extensive history taking and physical exams and potentially doing some lab work. And depending on what type of information that is gathered, the doctor will then work with the patient in order to create an individualized treatment plan, and depending on what is needed, different modalities will be used.
Speaking of modalities, you might be wondering what modalities are within the scope of a naturopathic doctor. So what Sarah mentioned earlier, lifestyle counseling, we like to focus on diet, hydration, exercise, stress, sleep, your support system, relationships, anything like that we gather within the first intake, we focus on optimizing. And then we also like botanical medicine, which Essence of Damiana really focuses on, and you can learn more about each herb through our Instagram. And then we also have homeopathy, physical medicine, mind-body counseling, clinical nutrition, IV therapy, and minor surgery. And depending on your state, ND scope can include acupuncture, midwifery, and clinical counseling.
So we get a lot of questions about our education, so we're going to talk about naturopathic medical school next. And the first 2 years of our education basically involves a lot of classroom time where we learn about the biomedical sciences, which includes anatomy, physiology, histology, biochemistry, microbiology, immunology, and pathology, all of those. And then also other classes like clinical diagnosis classes and counseling classes, which is where we learn how to form therapeutic relationships with our patients and where we gain our multicultural competence. And then the next couple of years involves a lot of time in our student-run clinic, but we also have other classes such as treatment classes, which is where we learn about clinical nutrition. And something unique about naturopathic medical school is that we actually have around 200 hours of training in nutrition. And then we also, of course, learn about botanical medicine, our favorite, and homeopathy, physical medicine, which involves also hydrotherapy, medical ethics, minor surgery and IV therapy, and pharmacology, which might be somewhat of a surprise to some people. But here at Bastyr, we do take 6 quarters of classes, of pharmacology classes, and that's just so we make sure we gain competence in that area.
So we get a lot of questions about what our clinical experience is like as a student clinician. So before we go into our student-run clinic, we're required to pass a clinic entry exam after our second year, which we showcase our therapeutic alliance with the patient, also our diagnostic skills, and our competence to perform a physical examination. Once we're in the clinic, we have to continuously show the supervisors that we are competent in seeing a wide range of conditions as well as different patient populations, and that we can perform physical exams and come up with the right treatment plans. Before we graduate, we're required to have at least 1,200 hours of clinical experience within our clinic, as well as a minimum of 450 patient contacts. And then additionally, outside of our clinic, we're also required to complete at least 132 hours of preceptorship hours with other NDs or MDs, chiropractors, midwives across the country.
People often wonder if a residency is required, and a residency is not currently required for NDs to practice. However, a lot of people do opt to do a 1 to 3 year residency. So now that you've learned a lot more about naturopathic medicine, you might be wondering how to find an ND in your area. Later this week, we are posting an infographic highlighting the states where NDs are licensed, so stay tuned for more information on that on our Instagram. In the meantime, there is an American Association of Naturopathic Physicians, which has a great database on how to find an ND in your area, so you can find that URL below.
And thanks for tuning in to learning about naturopathic medicine. If you have any questions, please leave us a comment so we can make future videos on it or future infographics on our Instagram channel. And we'll see you next time.
Thank
Bye.
you.